This training is provided by the OVID, the Office for Value and Innovation in Healthcare Delivery. This training serves as an introduction to Focus PDSA. Additional training is provided through the OVID. This training is more interactive where participants will do a hands-on activity working with an OVID facilitator. If you're interested in attending or interested in learning more about PI, visit us on CareWeb. Now that you have completed Focus, you are ready to move to the right-hand side of the storyboard. This is referred to as Plan, Do, Study, and Act. Each phase follows scientific thinking where we become science experimenters. Teams will develop a plan to outline step-by-step how the solutions will be piloted and carried through for implementation. Teams will then carry through with piloting or trialing their proposed solutions. As data is gathered during this pilot phase, teams will determine if the solution is effective. If the solution is impactful and sustaining, the team proceeds to act. If not, the team may engage in multiple cycles of developing alternative solutions and testing until results are achieved. Teams will lastly act to either implement the solutions on a broader scale or consider alternative plans to ensuring the solution is effective. The illustration depicts the importance of planning in any problem-solving efforts. Planning in this case is referred to as the focus and the P of the storyboard. A team's success can be gauged by how much time and effort they put forth in planning and effectively completing each portion of the storyboard in sequence in a very methodical manner. Teams experience savings in time with good planning. P of the storyboard stands for Plan the Improvement. One of the first steps is to create a future state process map. Recall the current state process map completed in C. When comparing the two process maps, the team should determine whether the process has been simplified and waste has been eliminated. Does the team observe where the number of process steps have been reduced? Have tasks been eliminated or combined to simplify the process? Are less people involved in the process? In the example, the number of stakeholders and people involved in the process was reduced from 5 to 4. In addition, you can observe the number of process steps was reduced and waste was eliminated. The next step is to create an action plan. The action plan should be detailed describing the testing, implementation, and monitoring of the improvement efforts. This includes the tasks, the activity owner of the person responsible for the action item, when it is due by, any notes providing updates, and lastly a determination of whether the task is completed in progress or requires special attention to eliminate a barrier. If the team may recall, the SMART goal developed in C notates when the solution will be implemented by. The team should take the opportunity to review the SMART goal a second time to ensure the dates coincide with the anticipated implementation date. If it does not, make the necessary changes to the SMART goal in C to ensure its accuracy. Some helpful hints to a successful implementation include obtaining buy-in from key stakeholders, leadership, and frontline staff on change ideas. Delegating responsibilities is key where team members are part of the implementation planning. This provides greater chances of buy-in and sustaining of suggested changes. Anticipate that change may not be easily receptive to those impacted by the process changes. Consider ways on how to counter such concerns by carefully listening and reassuring the change is effective by displaying the data. Keep in mind not all suggested solutions work. Data provides an added reassurance that changes are impactful. As part of the planning, the team may want to have alternative plans in case the solution does not work. Ensure staff understand the implementation plan and have a resource or contact to reach out to in case the solution is not working as planned. The team may also want to consider a daily huddle to see how the proposed solutions are working. This keeps staff engaged and provides a pathway to adoption. Once the timeline has been established and there is a concrete plan of action for improvement, it is time to implement. In this phase of PDSA, you and your team will be piloting your change ideas for a set period of time and collecting data to determine its success. The key to a successful pilot is to have managerial support as well as those working directly on the front lines. Throughout the pilot, your team should be conducting observations of the process to see firsthand how your change ideas are affecting the process, noting any abnormal or unexpected results. Because PDSA is a continuous cycle, it is okay if you need to make adjustments throughout the pilot. The keys to remember for this phase are that you and your team need to have a sound plan that all staff members are aware of. You need to have data collection methods and understand it's okay if the pilot fails. You can easily tweak and change your new process as necessary. The third step of PDSA is S, or study the results. Study in PDSA refers to the phase where the team summarizes the pilot results to determine if an impactful change has occurred. A visual in the form of the graph is helpful to determine if data is trending in the right direction. Looking at the clinic example, historical data was tracked and compared to the target of 20 minutes. By displaying the graph, team members can see there is clearly a gap. As the team began to pilot solutions, there was a decrease in the percentage of OFV clinic visits over 25 minutes. The team continued to make refinements to the pilot, including making adjustments to ensure sustainable results. Between May 25th and December 25th, the percentage of OFV visits was reduced to 20%, which was the team's goal. The steps in Study the Results include continuing to collect data at various stages, including the beginning to gather baseline, during, and after system-wide implementation. The goal of collecting the data is to analyze to determine if the team achieved its desired outcome by trending the data. Continue to drive improvements with go-sees or observations. It is recommended to observe and speak with frontline staff and patients to determine if the process has improved. Team members are encouraged to document pilot and system-wide implementation. Pilots have the risk where things may not work as anticipated. When this occurs, it is imperative the process owner is on hand to ensure barriers are eliminated. Another approach may be where the team goes back to the drawing board, including identifying new root causes in U, and/or identifying additional solutions to implement in S. The final step of PDSA is acting on the results in study and determining next steps. Throughout your pilot, the act phase is completed as you check and adjust your pilot. Once your pilot has been completed, your next steps depend on whether your desired outcome has been met. If your desired outcome has not been met, your team should brainstorm what went wrong, how this can be addressed with a new pilot, or if your team should conduct a new focused PDSA cycle. A new improvement cycle is necessary if your team determines after the pilot that the root cause aren't being addressed or that your change ideas are simply ineffective. If your desired outcome has been met, your team should develop a plan to continue to collect data and monitor the results. Your team will also want to start a new PDS cycle, but this time on expanding your pilot. In continuing and expanding your pilot, your team should develop education material to keep stakeholders informed, as well as a reflection document to catalog the barriers the team encountered and what lessons were learned going through this process. In our clinic example, the team has put together a sustainability plan to ensure their improvements do not get lost weeks or months down the road. This is another critical step, ensuring that your change ideas continue long after the improvement process is completed. Finally, the last step in ACT is to determine and challenge your team to continue to look for processes to improve. PDSA is a continuous cycle, and improvements shouldn't stop just because one cycle has been completed.